I'm Dr. Robert Kessler, and I'd like to tell you a little bit about the HCG Diet. It's a program that I've been offering in my office for about the last 10 years, and my patients have gotten amazing weight loss results. When I first came into practice, I was doing a great deal of body contouring after significant weight loss. And what happens is after weight loss surgery, patients can plateau at a point that is still well above their ideal body weight. And in the, again, early part of my practice, I would say, look, I really need you to go home and try to lose another 25 pounds. And nobody came back, right? And I realized it's incredibly difficult to lose that weight. And started to look for, vehicles to help people do this. And I discovered the HCG Diet. I've been using it in the practice about 15 years, and it's probably been around for 50 years before that. It is incredibly safe. It was pioneered by a physician whose last name was Simeon, and his paper is actually on the web as something if you're interested in looking at. But basically what he discovered was very, very low dose of HCG puts the body immediately into ketosis. So unlike the Atkins diet, where if the only way to put your body into ketosis is to simply eat only proteins and fat, now, hormonally, that switch can be turned on with HCG. The other thing that is fascinating is it's a vehicle that allows the body to then mobilize its stored fat. And so what you've got now with this HCG diet done on a calorie restriction, there is a way to not only burn only your fat, but mobilizing stored fats. One of the things I love about this program is if we were to do body composition studies before the diet and then after the diet, what you would see is there would be no loss of skeletal muscle mass. And that's because HCG also protects your skeletal muscle. The calorie restriction is interesting. Simeon actually did the diet with supplements alone and found that it was possible. The reason being is that your body is seeing calories from your mobilized fat. But psychologically, we all need to eat, right? It's just something that makes us satisfied. It's an experience that we enjoy. So the calorie restriction is 500 calories, and the way the meals work is a 3.5 ounce portion of either beef, chicken, or fish, 3 ounces of vegetables, piece of Melba toast, piece of fruit, usually an apple or an orange, and all the coffee, tea, and water you can drink. And there are 2 of those meals during the day. What I've evolved to is taking the Melba toast and the fruit out so that you have something for breakfast, and then a snack around 2 o'clock in the afternoon, and then the protein and vegetable as your 2 main meals. And what we see when we do this properly, and we do it for 30 and 40 days, people lose on average about half a pound a day. And so it's been just an incredible addition to the practice, and it's really brought people that are going to have difficulty getting the aesthetic results that they want because of their weight are now able to come in and have their surgery. But the other thing that I've seen, when a person is overweight and you go ahead and do that surgery, their complication rates go up. So not only do they have a suboptimal aesthetic result, but they have a higher rate of complications. So when I see someone for body contouring who is above their ideal weight and more closer to a BMI of what is 28, 30, I will often recommend doing this short course HCG diet and then perform their surgery shortly after completing that.